Mediterranean and keto diets for weight loss and lower blood pressure. Welcome. Today, we're diving into how the Mediterranean and ketogenic diets may help with weight loss and lower blood pressure. Hypertension, commonly known as high blood pressure, affects about 1 in 3 adults worldwide, according to the World Health Organization. This condition occurs when blood flows through arteries with too much force, leading to serious health risks like stroke, chronic kidney disease, and even dementia. While medications can help manage hypertension, lifestyle changes play a crucial role. Eating a healthy diet, avoiding smoking, exercising regularly, and managing stress are all vital components. Traditionally, the DASH, which stands for Dietary Approaches to Stop Hypertension, is a healthy diet focused on reducing blood pressure and promoting overall well-being. However, recent studies have highlighted the Mediterranean and ketogenic diets as effective alternatives. A new study published in the journal Nutrients provides fresh evidence about the benefits of these diets. Researchers found that both diets significantly lowered blood pressure and led to weight loss among participants with obesity or overweight. In this study, 26 adults who either had high normal blood pressure or grade 1 hypertension were recruited. Some followed the Mediterranean diet, while others followed a ketogenic diet over 3 months. At the study's conclusion, those on both diets showed decreased blood pressure and significant weight loss. Additionally, participants gained fat-free mass and exhibited lower body fat, blood lipid levels, and insulin concentrations. Researchers noted a difference in nocturnal dipping, a healthy blood pressure drop during sleep. Dr. Chenghan Chen, MD, board-certified interventional cardiologist and medical director of the Structural Heart Program at Memorial Care Saddleback Medical Center, said the keto diet group experienced greater nocturnal dipping, which benefits heart health. This indicates better blood pressure regulation. While both diets emphasize reducing carbohydrates and sugars, they offer different food options. Dr. Mir Ali, MD, board-certified general surgeon and medical director of Memorial Care Surgical Weight Loss Center at Orange Coast Medical Center, recommends these approaches for managing obesity and heart health. Working with a registered dietitian can be crucial when considering which diet is proper for you. They help tailor dietary choices to fit your health needs, goals, and lifestyle. Please don't blindly follow the influencer's diet. A successful dietary approach is sustainable in the long term. Focus on nutrient-rich foods such as healthy fats, non-starchy vegetables, lean proteins, and whole grains. There's no one-size-fits-all when it comes to diet. Ultimately, find what works for you and embrace a healthier future. Thanks for watching. Don't forget to like, subscribe, and explore how to manage your health through diet.